Hey everyone, today I'm back with another mock USMLE question. This is going to be question number 19. So the question is, you have a 55-year-old male, past medical history of type 2 diabetes mellitus, hyperlipidemia, and Crohn's disease. He comes to the ED with right flank pain. Patient states that the pain started 4 hours prior to presentation. He describes the pain as sharp, paroxysmal, and states that the pain radiates to the right groin. On review of systems, patient denies fever or chills, but does endorse nausea, vomiting. Temperature is 36.4. Blood pressure is 142/90. Pulse is 102. On physical examination, patient does have right flank tenderness. On laboratory findings, WBC is 4.5, creatinine is 0.8. UA demonstrates hematuria with a negative leukocyte esterase and nitrites. On CT abdomen pelvis without contrast, patient is noted to have nephrolithiasis in the right proximal ureter with a stone measuring 4.5 millimeters. What is the most appropriate next step in management? The options are observation with pain control, shockwave lithotripsy, uteroscopy with laser lithotripsy, or percutaneous nephrostomy tube. If you need more time, go ahead and pause the question right here. So the correct answer to this question is observation with pain control. The reason that's the correct answer is, so for kidney stones, it's really important to remember that the management is dictated by how large the kidney stone is. And there are three categories to know. If the kidney stone is less than 5 millimeters, if the kidney stone is from 5 to 10 millimeters, or if the kidney stone is more than 10 millimeters. If the kidney stone is less than 5 millimeters, in that situation, the vast majority of kidney stones will be able to resolve spontaneously. So generally, you manage these conservatively. Just ask the patients to to drink fluids and management with pain control. When the kidney stone is between 5 to 10 millimeters, in that situation, the vast majority of stones, once again, are able to resolve spontaneously. But for these patients, sometimes it might be beneficial to give them an alpha antagonist like tamsulosin, which will help pass the kidney stone. Now, if, like I mentioned, there are three categories. And the last category is if the kidney stone is bigger than 10 millimeters. Now, that's a category where stones are less likely to resolve spontaneously. So in this situation, it's actually very important to consult urology for next steps. Now, depending on where the location of the stone is, urology will decide the next steps in terms of potentially doing cystoscopy with stent placement versus percutaneous nephrostomy tube. So once again, the management of kidney stones is going to be depending on the size of the stone. If it's less than 5 millimeters, manage conservatively. If it's between 5 to 10, you can consider starting the patient on tamsulosin, but once again, management conservatively. And if it's more than 10 millimeters, consult urology for next steps. One thing that's also important to remember, and one thing I kind of mentioned in the question stem, is I mentioned the creatinine. So the creatinine for this patient is normal at 0.8. A lot of the times, if you have a patient with kidney stones, a lot of people think that it's normal to have elevated creatinine. It's not. If a patient has kidney stone, particularly if it's just one-sided, creatinine should not be elevated. So even if a patient has a small kidney stone, but the creatinine is elevated, that's telling you that something else is potentially going on. So it's very important to consult urology in that situation. But if the creatinine is normal and if the kidney stone is small in size, once again, you can manage that conservatively. The last thing I wanted to talk about is when should you admit patients versus just recommending outpatient management? If the kidney stone is once again small, less than 10 millimeters, and patient has pain control that's adequately managed with oral analgesics, then generally you can manage that outpatient. But if the patient has severe nausea, vomiting, severe pain, is unable to take oral pain medications, in that situation is when you typically admit patients. Along with that, you would also admit patients if they have a very large kidney stone where you actually have to consult urology. I think that's going to be it for today.